Hello again, my name is Rebecca Liptak. I will be doing a video presentation on collaboration and leadership reflection. For Capella University, the class is NHS-4010, Leading People, Processes, and Organizations in Interprofessional Practice. During this video, I plan to 1. Reflect on interdisciplinary collaboration experience, noting ways in which it was successful and unsuccessful in achieving desired outcomes. 2. Identify how poor collaboration can result in inefficient management of human and financial resources supported by evidence from the literature. 3. Identify best practice leadership strategies from the literature which would improve an interdisciplinary team's ability to achieve its goals. 4. Identify best practice interdisciplinary collaboration strategies to help a team to achieve its goals and work effectively together. During my presentation, I will also mention the articles, the authors, and all of my literature is peer-reviewed. Great, let's get started. The first article that I chose was Interprofessional Teamwork and Collaboration Working Together for the Good of the Patient by Beth York. In this article, she talks about 5 competencies created by the Interprofessional Education Collaborative Group created for interprofessional collaboration. She discusses the need for role clarity. She says, quote, "To effectively work together, each person needs to know the knowledge, competence, and scope of practice of the others. If we do not clearly know this, it will pose a challenge not only in collaborating with others, but in the aspect of delegation and safety of our patient," end quote. York 2021, page 109. It is essential to know not only the scope of practice of the one you're collaborating with, but the competence. I have a personal example from my clinical rotations. The task was to transport an elderly patient after a total hip transplant. The patient displayed terror on her face from the extreme fear of falling. There was me, another nursing student, and the nurse. The other nursing student did not know how to hold the patient or proper body mechanics required for the transfer. The patient ended up 1 inch away from the floor, almost in a fall. The nurse and I were carrying the patient to prevent her from reaching the ground. Many things could have improved in this situation. Let's reflect. First, the nurse should have assessed our competence as nursing students regarding transferring a patient from bed to chair instead of just assuming we know how to do it safely because it was basic. Even if she did assume that we know how to do it safely, she could have verbally given direct instructions to each of us so we know our role during the process. Second, the nurse could have ensured that the IV pump was close to the bed instead of across of the bed of the patient. She could have ensured that the bed was at the lowest position and that the chair was closer to the patient. She could have also directly spoken with the patient to address her fears and to contribute to more cooperation from the patient to transfer her effectively. But the nurse just abruptly insisted that we move the patient, ignored her feelings, and never reassured her fears. We ended up putting the patient back in bed. I took the initiative to instruct the nurse to bring over the IV pole. I brought the chair closer and I demonstrated to the nursing student how to properly hold the patient for a successful transfer. We did end up successfully transferring the patient, but the negative outcome was that we broke the patient's ability to trust that we can keep her safe. And the incident reinforced the patient's terrifying fear of falling. It is vital that we have a daily reflection at the end of our workday. It is a crucial factor so every individual can improve their patient care in the future. According to the National Library of Medicine, reflective practice is described as, quote, "a cognitive skill that demands conscious effort to look at a situation with awareness of own beliefs, values, and practice, enabling nurses to learn from experiences, incorporate that learning, and improving patient care outcomes. It also leads to knowledge development in nursing." End quote. Patel and Matursky, 2021, paragraph 4. The National Library of Medicine also published an article titled "Reflective Practice in Healthcare and How to Reflect Effectively." The article outlines why healthcare providers should reflect on patient encounters and lists excellent questions to help us do so thoughtfully. The article spotlights that one of the most important things that you could do is understand why you're asking the question. They outline a list of questions that we can ask. Generally, we ask what happened, why it matters, and what are the next steps. 2 questions that stood out to me the most was 1, how did it make you feel? It is important to know our personal feelings and check our biases to explore how this mentally and emotionally affects us. Perhaps something triggered you, and you were clueless that the trigger even existed. Taking care of our mental and emotional state is first. We can only perform our best when we feel our best. We can also explore how these personal things influence our patient care, because they will, and they do. The second question is, what could you have done differently? It is essential to commend yourself with what you have done right. Good job. And recognize where improvement is needed. Then intentionally setting a goal for the similar situation in the future. and highlighting the improvements that we're going to put into practice. As you regularly reflect, seeing how the reflection impacts you is also helpful, noticing the positive parts and adjusting anything that you might encounter that is negative. The article gives a great idea to speak to a peer or a senior so they can point out things you may not notice. The best voice is the voice of experience. Self-reflection will refine the personal qualities along with benefiting your daily practice professionally to become a better student and teacher. The only route to growth is through learning. We can only learn to improve through self-awareness. Self-awareness comes through reflection and asking the right questions in a humble state of mind. Let us continue to take steps towards reflective practice to bloom as individuals and give our patients the most exceptional care imaginable. In the healthcare environment, collaboration is also required among physicians and surgeons. In the next peer review article that I found called Interdisciplinary Collaboration to Enhance Patient Care by Susan Kramer, she mentions a group of doctors who meet weekly to assign patients to doctors that best meet the patient's needs. They also have a daily morning huddle with the entire interprofessional team. This team of doctors show proactively regarding collaborating for the patient to have the safest and most adequate care possible. The article mentions how the patient is part of the team and how we need to listen to the patient for it to be considered patient-centered care. It is encouraged for whoever has the authority in the particular situation to ensure that everyone on the team has a voice and not allow hierarchy to determine if someone is allowed to voice their concerns or not. With the scenario in Villa Health, the ones in power, corporate, did not give the rest of the team a voice, although everyone was expressing their concerns very loudly. In turn, not only was there division created in the entire facility, but the patients received inadequate care, which is unacceptable. Listening to the patient and the other people on the team is essential to collaborate successfully. In the last peer review article, it states data that supports the thought of communication issues contributing to inadequate teamwork and collaboration in patient care. The name of the article was Patient Safety, Creating a Culture to Change Support Communication and Teamwork. In the Joint Commission's Centennial Event Database, they reported, quote, 65% of the identified adverse events have been found to have communication failures as the underlying root, end quote. Petit and Duff, 2015, page 24. The Institute of Medicine, IOM, reported that preventable medical errors cause approximately 98,000 deaths yearly, an additional cost of approximately $29 billion, which is what the hospital really cares about. The IOM reports that errors often occur during handoffs and transitions during care. In the United States, there are many cultures and ethnicities, and this can impose a challenge in regarding to verbal and nonverbal communication. For example, if an individual is non-assertive or comes from a culture that shies away from challenging opinions, they might be hesitant to speak up. It is also essential to consider the negative response received when challenging a question or questioning a physician. It was even the case when the patients were in a deteriorating state. They were hesitant to contact the doctor, which is completely absurd. They try to avoid for these reasons, quote, intimidation, fear of getting into confrontational or antagonistic discussion, lack of confidentiality, fear of retaliation, and the fear that noting nothing ever seems to change, end quote. Petit and Duff, 2015, page 24. Despite what the physician dishes out, the nurse must be able to stand their ground, mainly because they are advocating directly for their patients. If they are not able to do it, who will? Also, when the patient detects a disagreement with their interprofessional team, it creates an environment of doubt and lack of safety. It creates a challenge to build rapport with the patient and gain their trust. The article proposes that we use the team strategies and tool enhanced performance and patient safety tool. It is an evidence-based training tool which focuses on specific skills and supporting team performances, principles, behavioral methods to improve quality and patient safety. I agree with their concept of educating the staff together because our nurses and physicians are usually trained separately. The training is based on learnable skills like communication, leadership, situation monitoring, support. It is excellent training to have biannually with nurses, physicians, surgeons, including the residents on each unit. It is helpful that it uses authentic clinical events so both parties can work on their problem-solving skills and teamwork. During these simulations, they can build relationships and learn how to talk to each other effectively. It is also helpful to identify anything that needs more work so it can be addressed during the simulation and not during patient care. I have witnessed patients suffering from delays in care because of communication issues with their interprofessional team. Communication is crucial for the patient to receive safe medication administration in a timely fashion. There is no collaboration without effective communication. It is vital to foster a welcoming environment to promote teamwork, collaboration, and effective communication in the healthcare facility. We can improve as individuals through reflective practice to create an unstoppable team. It is significant to remember that everyone's role on the team matters. One cannot do their role without the other. Therefore, everyone should feel welcome to voice their concerns and opinions to give the patients the best care possible. Thank you for listening to our presentation. I was speaking fast in order to meet the requirements of the time limits of this video. Alrighty. Have a wonderful rest of your day. Thank you for your attention.